Vincent, cataracts can be easily solved, yet for millions in Africa, help is out of reach. One organization, See International, is on a life-changing quest to change that. Cataract blindness prevents millions in Africa from seeing their children or earning a living. Removing a cataract is simple and relatively inexpensive. So why are so many still living in darkness?
Most people are aware of the disease, but it's almost expected. Many people think that it's God's willing that it should happen, when it can be resolved if they just had access to good visual care.
What's preventing people from actually getting the care that they need?
A lack of available qualified surgeons, a lack of supplies, a lack of hospitals and clinics where they can treat the patients. So in the United States, there's 56 ophthalmologists per million people. But in Africa, especially sub-Saharan Africa, there's only an average of 1 or 2 ophthalmologists per 1 million people. So you can see how access to appropriate care is a problem.
See International in Southern Africa, bringing doctors, surgical supplies, and hope. Volunteer ophthalmologists from around the globe team up with eye surgeons in African countries.
We go out on short-term programs which will last approximately a week, and we'll be able to do anywhere from 100 to 300 eye surgeries during that period of time, and a tremendous number of screenings too.
These partnerships that you have with local doctors and local clinics, how do you establish those partnerships and how do you keep them going?
We go by invitation only. And what we find is that host ophthalmologists on the ground will need more surgeons to help. They'll need more intraocular lenses, more microscopes perhaps. And they'll let us know what they need. We'll provide what is needed. We never show up when we're not invited by a host on the ground. And that also helps with local ministries of health and civic authorities, because everything is done in a great collaboration. And then there's a great multicultural exchange that occurs. These people become fast friends for life usually. They go back year after year. Our greatest success has been in Namibia. The doctor that I work with there, Dr. Helena Ndume, is the first ever Nelson Mandela Prize winner because of her work in that country. And she's done 35,000 sight-restoring surgeries there alone.
Life-changing surgery, free of charge. Avolio says information is key to reaching as many people blinded by cataracts as possible.
We will do a radio broadcast where we will ask people to come. We will say that there's going to be an eye clinic. Please bring your daughter, your mother, your grandmother, anyone who cannot see, that this is their chance to see again.
And when someone's sight improves, so do their economic prospects.
Most of the time, a child or a young adult gets taken out of either school or the workforce because they have to tend to the person who is blind. So it really does have a double economic and education impact on individuals. Somebody goes from being blind to being sighted essentially in one day. The patch comes off, they can often see 20/20 or close to it. Most times they need no other care for the rest of their lives in regard to having their eye taken care of.
And See International has conducted tens of thousands of eye surgeries in Africa over the past 40 years. Avolio says every one of those surgeries is an investment in someone's life, community, and country. Vincent?
Well, that's amazing.